Now, when we talk about exercise, we have to talk about the different parts of exercise, the anatomy of exercise. It's really simply composed of the duration, the intensity, the recovery, and the frequency. How many times you do the duration, intensity in a given workout, and then you can also talk about the frequency per week. And so there's different variables to exercise that create different effects. For example, duration. If you exercise at a certain constant rate of exercise over a long period of time, let's say you're doing a marathon, that tends to spike cortisol. And the third factor of recovery is very, very important too, especially if you're trying to lose weight and especially if you're trying to get rid of soreness, for example. Because if you over-exercise, you overtrain, and you don't get the recovery, that puts a tremendous amount of stress on your heart, on the muscle tissue. But today I want to talk about the importance of intensity. So number one, doing a workout that has a sufficient amount of intensity can increase your aerobic capacity. It increases more capacity to deliver oxygen to your muscles. And so more oxygen to the muscles is going to get rid of the lactic acid buildup. You'll have more endurance, and overall you're going to repair a lot better. All right, number two, there's a greater reduction in cardiovascular disease and premature death. Now this is interesting because you would think the more intense you go, the more dangerous this exercise would be, but apparently not, especially if you keep your duration shorter. And I think the reason why, especially if you're comparing an intense workout to, let's say, a moderate amount of intensity over a sustained period of time, the sustained exercise is working against the heart because it's not following a wave-like pattern where you're doing short duration, high intensity, short duration, high intensity. The heart works on the rhythm, so any type of exercise you can mimic a rhythm is a lot healthier than a sustained type of workout. All right, number three, significant improvement in insulin sensitivity. So if you're a diabetic, if you are a pre-diabetic, if you have insulin resistance, or you're in keto and you're trying to speed up the results, which is all about improving insulin resistance and reducing insulin, the intensity of exercise is what you should focus on. All right, number four, intensity is a potent trigger to increase growth hormone. Now, what is growth hormone? It's a hormone that's made by your pituitary. It works through the liver, and it's an anabolic hormone. That means it builds things up. It builds your muscles up. It helps you make certain proteins other than muscle protein. It helps grow your bones. It helps grow your organs. And as you get older, it starts going down. So after the age of 50, it's very important to do some form of exercise that involves intensity with a lot of recovery. Also, growth hormone is all about calcium retention in the bone, fat burning, it's anti-aging, it helps your immune system, and it helps you convert T4 to T3, the active form of the thyroid hormone. Interesting. So, intensity is a potent trigger to growth hormone. You also have sleep, delta wave sleep. That's when you trigger the majority of growth hormone. Also, having low blood glucose can help stimulate growth hormone. That's keto, right? Low carb. Vitamin B3, niacin can help stimulate growth hormone. Fasting is a potent trigger of growth hormone. Keeping your stress low will also help you enhance growth hormone because as soon as you increase cortisol from stress, you diminish your growth hormone. And of course, the last one, which I already mentioned, the intensity of exercise is a potent trigger for growth hormone. Hey, before you go, if you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below.